Hello everyone. 日本語で失礼します。
Let me now switch to Japanese. My name is Miki Hosoya from National Cancer Center Hospital based in Tokyo. Welcome to Japan to all of you. I appreciate this opportunity to speak here. Thank you very much for the organizing committee. I have no disclosure. I will cover these topics. Background of lung cancer and mesothelioma in Japan. I first provide you an overview, then the oncology nurse role in the treatment of lung cancer and mesothelioma as we practice now. First is just my personal episode. I became a nurse because my grandfather died of lung cancer. At that time, that was 31 years ago, 6 months after diagnosis, he passed away. Nowadays, there are various options, and I wish that when my grandfather was still alive, I hope that there had been many more options. First, background of cancer in Japan. Cancer became the #1 cause of death since 1981. It remains that way. And in 1 year, newly diagnosis of lung cancer of 860,000, 370,000 die of cancer, and more than 1.5 million patients receive medical treatment. As you can see, cancer is one of the major concerns of life and health in Japan. Every day on TV program, you hear about the cancer and health. Next is cancer mortality in Japan. For men, lung cancer, gastric, CRC. In that order, the mortality is high. For women, lung, CRC, and gastric. The red portion is lung cancer. And as you can see, lung cancer is the top cause for mortality among various cancer types. This is my workplace, National Cancer Center, and it was established as the first national cancer center in Japan to advance further medical care, and it was established in 1962. There are 11 core hospital centers in Japan, and we are one of them. Japanese medical practice standard is very high, but we have more and more cancer patients, and some people say we are very much behind. So we need to cover more preventative medicine, and also standard medicine should be more broadly based in the registration system, and clinical research areas are where we are behind. In 2006, a Cancer Control Act was established in Japan. Based on this law, nationwide, anywhere you live, the patient should have access to good, high-quality practice. This shows the network of the nationwide cancer care network. We national cancer centers are the hub, and there are more than 400 district-designated cancer care hospitals nationwide. And the roles of designated cancer center or cancer care hospitals are defined like this: provide specialized cancer treatment, uninterrupted palliative care, and provide palliative care teams and community cancer treatment network system, and provide information and support. Next, let's talk about lung cancer and mesothelioma specifically. The number of patients suffering from lung cancer is increasing, as you know. As of 2013, 60,000 in men and 36,000 in women are newly diagnosed to have lung cancer. You can see the age distribution. The blue, yellow, and orange color, they are over 60 years, and they are majority of the patient. As you know, Japan is an aging society. Going forward, we will have more lung cancer patients. Risk factors are shown here: smoking, COPD, exposure to asbestos, age over 50 years old. This shows the smoking rate in many countries, and Japan, circled in red, is for men. Smoking rate is 34%, for women 11%. Compared to UK, US, and Australia, men smoking rate is more. For passive smoking, that is a social issue. We are having Olympic Games in 2020, but there are some political conflicts, and it's rather difficult, seems that, to make adjustment to improve the situation. So a high smoking rate is a big factor in Japan when it comes to lung cancer. This shows the trend in lung cancer. We have 45% of lung cancer, adenocarcinoma, squamous 30%, and small cell is not so much. And for female, 70% is adenocarcinoma. And identifying driver genes is very important in lung cancer treatment. About 40% is adenocarcinoma, and EGFR positive cases are rather significant. Compared to Western population, EGFR mutation is higher among the Japanese. This shows the treatment of non-small cell lung cancer in Japan. This is based on guideline of Japan Society of Lung Cancer Medicine, and it's used nationwide. For example, for stage 2 and inoperative stage 3A and 3B, we use those regimens. For stage 3B and stage 4 advanced cancers, EGFR mutation positive, then for the first line, EGFR inhibitors are used, including gefitinib, erlotinib, afatinib. And the skin or liver toxicity or diarrhea often observed event. And also for ILD, interstitial pneumonia is observed in 4 to 5%, of which 1% is said to be fatal. For ALK fusion positive cases, then alectinib is used, then crizotinib is recommended. For EGFR negative, ALK fusion negative, and LOS1 negative, and PD-L1 positive in more than 50%, then pembrolizumab is recommended, then platinum-based regimen, and the third generation anti-cancer drugs are recommended. This is for stage 3B and stage 4 platinum doublet regimen. Next is for mesothelioma. In 2013, the number of deaths exceeded 1,400, and we expect more will come going forward. For malignant mesothelioma therapy in operative cases, then surgery, and then cisplatin and pemetrexate for inoperable stage. That's the recommendation according to our guideline. Our center, National Cancer Center Japan, gives this overview, and we have 1,400 patients per day, and there are 62 beds outpatient, and 150 patients receive chemotherapy daily. Annually, more than 320 trials are performed, And there are more global studies increasing nowadays, about 170 trials, and the number is increasing year by year. Nowadays, lung cancer clinical trials are more and more globalized. Lastly, the oncology nurse role in the treatment of lung cancer and mesothelioma. Japanese people have more EGFR mutation, and the adverse effect, side effect management of EGFR inhibitor is very important for prophylactic. It's important to keep cleanness, moisturization, and protection for skincare, and that is provided by the nurse. And the dermatological event may happen in some timings, so early detection and appropriate management is very important, and that is being educated. Nurses' role includes education and support of patient and family, and the patient should be able to maintain active role in the society or workplace or at home, and also pay attention to physical, psychological, social, and spiritual needs. For relapse or stage 4, survival is prolonged. However, it's impossible to cure for those patients in those stages. Patients are aware they are going to die soon, and with that anxiety, they need to live every day. But still, they should be able to realize their full potential. And for that, we do active listening and support for coping. That's the assistance we provide, and also management of adverse events and symptoms. That's also our responsibility. And Japanese people do not mention pain very often, or they are not very good at expressing themselves when the pain hurts. Therefore, interdisciplinary team approach is very important. For example, in palliative care, pain management would be important, and for dermatological conditions, dermatology-specific nurses can address, and whether to continue work or not, medical social workers can listen to the patient. So many people with different backgrounds in interdisciplinary team is very important. And the ward that I work is specialized in clinical trials. More than 50% of the patients in the ward receive or participate in clinical trials. So our role here is that the patient understand merits and demerits of the trial, and they participate in trials with good understanding. We need to ensure that, and we need to monitor negative effects and collecting samples that are required for trials. Lastly, this is my take-home message for you. The core value of nursing in the treatment of lung cancer and mesothelioma is the patient understand the merit of demerit of treaties, and they should be able to have very good informed choice. Each patient has different values and individuality. We need to respect what is important for the patient, and that should lead to better patient QOL. Thank you very much.
Thank you very much.